Hello, my name is Allison Palmer. I'm a licensed clinical social worker. I work on an inpatient psychiatric unit for adults ages 18 and over. I've been in this field for about 23 years now.
What are some mannerisms that those with borderline personality disorder portray?
So I've worked with patients with borderline personality disorder for many years, and some of the main characteristics include impulsive behaviors, unstable relationships, difficulty with low self-esteem. Many of them have had very traumatic childhoods or have grown up in situations that were emotionally or physically or sexually abusive.
And how do these symptoms affect daily life?
For some patients, it can be quite destructive. Because of their impulsive behaviors, they tend to put themselves in very dangerous circumstances, very unsafe circumstances, and also with symptoms of self-harm. So for some patients, it can cause extremely fragile or disconnected relationships with family members and friends. They have a strong fear of abandonment, so there's a lot of times they'll have problems with keeping relationships because they're very overbearing toward the people that they're around. So it can have very negative consequences.
Is there one particular behavior that when displayed you immediately know the patient has borderline personality disorder?
I think it's more a combination of things in their description of their relationships, in how they view themselves, because typically, like I said, they have very low self-esteem. The vast majority of the patients that I've worked with who have experienced sexual trauma in their life develop borderline personality disorder, but also patients who have had a lot of abandonment in their life experience it as well. So generally, when I'm interviewing a patient, the things that kind of tip me off are the way they describe themselves, the way they describe how they relate to other people, and typically have a sense of blaming all the others in their life for the circumstances that they're currently facing. So those are some of the key things that would give me an indication, and then doing a further historical review oftentimes will be beneficial too.
What is involved in the psychotherapy that is used to treat borderline personality disorder?
So this is exactly what it describes. It's a personality disorder. So it's not a genetic disorder like depression or bipolar disorder where medications are helpful. Medications can be beneficial in just offsetting some of the anxiety and some of the low self-esteem that these patients experience, but definitely not in the complete treatment. Dialectical behavioral therapy was created by Marsha Linehan several years ago, and that has become the premier form of treatment for people with borderline personality disorder. It uses a lot of techniques on learning how to self-soothe in healthy ways. Coping skills are extremely important in developing for these patients. And she just works with training therapists in this very specialized form, and it can be done both in individual therapy as well as group therapy. And if the patient is not completely isolated, their family members, by the time they get into treatment, then family therapy is also very helpful.
Could you describe one specific instance when you interacted with a patient that had borderline personality disorder?
Yes, I dealt with a woman in her early 30s, and she had come in for an extremely serious suicide attempt. And generally, in her case, she was extremely intellectual. She was a nurse by trade, as I recall, but she had been in a multitude of very unstable and very unhealthy relationships. And so in working with her, it was important, because she was a nurse, to help her kind of believe in the fact that she may be suffering from this disorder, and how her relationship patterns had come along and really influenced how she was behaving and how dangerous her life had become because of it.
Thank you so much.